study is a study of the use of oral cancer agents in Manitoba. Traditionally, people with cancer receive their treatment via intravenous at a hospital or clinic, and in recent years, the number of chemotherapy drugs available in a pill or tablet form has increased, and patients can receive their treatment for cancer not at a clinic or hospital. This is of more convenience to patients. We wanted to study the use, the prescription filling patterns, and the costs of these drugs in Manitoba. Additionally, in 2012, the Home Cancer Drug Program was launched. And this was a program that allowed patients to fill these prescriptions at no cost to them, not even a deductible. So we wanted to look at how that impacted the way that Manitobans were filling prescriptions. So prior to the Home Cancer Drug Program, patients filled oral cancer drugs the same way they filled any other prescriptions. They went to the community pharmacy, and if it was a pharmacare prescription, they paid a deductible. Until their family deductible was met, then pharmacare paid the remainder of their prescriptions. And we saw the way that these prescriptions were filled was the same as all prescriptions in Manitoba are filled. We see peaks and valleys depending on the time of year. We often see a drop in the number of prescriptions after the pharmacare year has restarted, and an increase of the number of prescriptions filled just at the end of the pharmacare year. After the Home Cancer Drug Program was launched, we saw that the prescription filling patterns for home cancer drugs smoothed out, suggesting that the Home Cancer Drug Program altered when Manitobans filled their prescription for oral cancer drugs. I think we found the costs surprising. Over the study period from 2003 to 2016, we saw that the cost of targeted anti-cancer drugs, the ones that act on molecular targets inside the cancer cells, increased approximately 10 times. This is for a few reasons. First, there were many more drugs coming onto the market every year, and there are more Manitobans using these to treat a variety of different cancers. These drugs are important to monitor the use and prescription filling patterns, as their costs are quite substantial. Well, we think the government should be aware of several things. First, that more and more Manitobans are using oral anti-cancer agents, which is a good news story for Manitobans. These drugs are usually more convenient for patients as they don't have to go to receive an intravenous therapy. Second, the Home Cancer Drug Program has impacted the way that Manitobans fill their prescriptions. They fill them much more regularly now that there is no out-of-pocket costs for deductible for patients with cancer in Manitoba.